Children are presumed to have constipation if they pass large and hard stools associated with pain while emptying the bowels or blood in or around the stools. Having bowel movements less than 3 times in a week, episodes of abdominal pain relieved after evacuating stools, and soiling between bowel movements are also typical symptoms of constipation. The diet is an important aspect of preventing and managing constipation, and choosing the right foods is something that parents and caregivers can do at home to help tackle constipation. That is what this video is about. Welcome to this channel, Pediatric Doctor at Home, by a board-certified pediatrician dedicated to providing accurate, practical, and concise medical education for parents and caregivers. Now is a good time to subscribe, so why don't you go ahead and tap that subscribe button? Thank you. Alright, let's carry on. The main aspect of dietary approach to constipation in children is the consumption of a high-fiber diet. Dietary fiber is sometimes called roughage or bulk. Fiber is a type of carbohydrate found in plant-based foods that the human body cannot break down, digest, or absorb. So it passes through the digestive system largely intact. There are 2 forms of fiber, soluble and insoluble, and they both play important roles in overall health. Soluble fiber dissolves in water and other body fluids, forming a gel-like material as it passes through the gut and helps to control blood sugar levels and decrease cholesterol. Good sources of soluble fibers include fruits, barley, oats, and legumes. However, when it comes to promoting regular bowel movements and treating constipation, insoluble fiber is more beneficial. Remember that in constipation, stool moves slowly through the large intestine, and the fluid portion of the stool is absorbed back into the body, leaving the stool hard and dry and consequently painful and difficult to expel. Insoluble fiber is indigestible and does not dissolve in fluid. Rather, it attracts water into your stool, sticks to the byproducts of digestion, and adds bulk to stool, making it softer and easier to pass with less strain on your bowel. It also helps to speed up the movement of stool in the digestive tract, thereby supporting regular bowel movements. Foods rich in insoluble fiber include whole grains, brown rice, nuts, seeds, and the skin of fruits and vegetables. How much fiber do children need? The recommended daily intake of fiber varies by age, sex, and specific dietary guidelines. Currently, there is no consensus regarding the exact amount of fiber intake for children and adolescents. Generally, for young children, about 10 to 15 grams per day should be enough, while adolescents and young adults can have about 25 grams of fiber daily for females and 30 grams for males. Offer a variety of high-fiber foods to help your child eat more fiber. Know that there is no extra benefit to giving excessive amounts of fiber. Your child may just feel bloated or have abdominal cramps. And when starting a high-fiber diet for a child who is used to eating a diet low in fiber, do so gradually so that the digestive system has a chance to adjust. In addition, it is important to drink a lot of water when increasing fiber intake. Too much fiber and not enough water can lead to hard, bulky stools, what you're trying to avoid in the first place. A high-fiber food contains 3 grams of fiber or more per serving. For pre-packaged foods, you can check the nutrition label to know how much fiber you are getting in each serving. On your screen, you can see the estimated amount of fiber per serving for some common food items. Many breakfast cereals have loads of fiber, especially bran cereal that can provide up to 13 grams per serving. Fruits are a healthy and delicious way to increase fiber intake. The amount of fiber consumed increases when the fruits are eaten with the skin on. Dried fruits like raisins or apricots are also convenient options, but be mindful of portion sizes as they are calorie dense. Like fruits, vegetables are an excellent source of dietary fiber. Some children naturally enjoy the taste of vegetables, while others may be more resistant to eating them. Try to incorporate a variety of vegetables into your child's diet. You can use leafy greens in salads, smoothies, or stir-fries. And you can add beans, lentils, and peas into soups, stews, and side dishes. The fiber content of grains can vary depending on the type of grain and how they are processed, as well as cooking methods. Whole grains are generally higher in fiber than refined grains, so choose whole grains over refined ones when you can. You'll notice that refined foods like white bread, white rice, and pastries are low in fiber, and that is because they have had all or most of their fiber removed. There is no dietary fiber in meat, fish, poultry, eggs, milk, yogurt, cheese. So keep this in mind, as eating these foods in large amounts may cause constipation even though they are nutritious and high in protein. It is essential though to make sure that the high fiber diet offered to a child is balanced with foods from all the food groups. Parents and caregivers should consider limiting or avoiding certain foods that can contribute to or worsen constipation. These include highly processed foods like fast food, processed meats, frozen meals, packaged snacks like chips and cookies, and high-fat foods like fried foods. If you have specific dietary concerns about your child, or if your child has a dietary restriction or medical conditions that require a low-fiber diet, consult your doctor for personalized advice. I hope you found this video valuable. Thank you for watching.